Okay, well, again, thank you very much for coming, and we're really excited that you're here on a Saturday to hear our talk. Today I'm going to talk specifically on using your own fat stem cells in treating arthritis, sports injuries, and autoimmune disease. But as Dr. Riordan mentioned, we treat other conditions, and we could personally talk to any of you that wants specifically to talk about their own condition, and I'll be glad to answer any questions afterwards. My journey into this, as Dr. Riordan was saying, I got my training in internal medicine. I'm from Panama, that's why I did my medical school, but I did my training in New York. Then I moved to San Antonio. I had a practice doing internal medicine, and I moved to Panama. Again, I'm from there, all my family was there, so it was a tough decision, but I'm glad I came back to my country, and I opened a practice really dedicating to wellness, to preventative medicine. And how I got involved, in 2006, I met Dr. Riordan through a common friend who was a doctor from San Antonio who had a heart condition, and a very tough condition, and his mother had died at a young age. Her sister died while we were in San Antonio, and he was heading in that same direction. He was looking at different options, and there was really nothing that traditional medicine could offer to really change his quality of life. So he found the center when it was in Costa Rica, and at that time they had not treated anybody with heart disease, but it made sense that it could help. So he got treated, and he had remarkable results. And so he calls me one day from Costa Rica that Dr. Riordan always wanted to go to Panama, so that's how we met. And we talked for a couple hours, and I was really impressed of what he was doing and how much stem cells, or adult stem cells specifically, had advanced. My knowledge in stem cells was basically almost non-existent, and that's really what happens with most physicians right now. There's a lot of ignorance into what stem cells are, first of all, and what they can do. They're definitely not a miracle cure, but they can help in a lot of these conditions. And as I will go through the slides, it's a very natural process. So I was really intrigued, and I was excited of something that I really wanted to do in Panama. And so we ended up meeting several more times, and we started the center. We had to go through a lot of regulations because obviously, as it happens here in the States, well, in Panama also had, their laws regarding that. Thankfully, they're more open, and they saw what we were doing as a very positive thing to help patients, and we went through all the mechanisms of getting the license and the law that was allowing us to do this. So we went through the equivalent of the FDA, and that's the reason how we were able to do what we're doing. And it's really exciting times of what's happening with adult cells in Panama. So, there's definitely a lot of media attention with adult stem cells. We hear almost every other day in the news now about stem cells and people who are doing them, and centers opening in other places, offshore, etc. And it's what makes us different. I think that's really the main thing. When I talked to Dr. Riordan, I said, well, we have to do it with medical guidelines and with scientific evidence, and that's really what I saw in him when we talked, and that's something that we always have pushed through and made us different, because we really go into what there's clinical evidence, and that's really a big distinction of what we offer that other places don't, and we're trying to get this regulated so it becomes a worldwide thing, and that's really the key issue from now forward. We're trying to join forces with other people working with this, and even here in the U.S., even though we know there's a lot of issues and there's a lot of political aspects that makes it very difficult for this to advance, but I think the evidence is overwhelming, and there's a lot of push now, even at the political level. And as you're well aware, Governor Perry here decided that he couldn't wait, and he had it done here, even though semi-illegally or illegally, but he but he's a powerful guy, and he did it. And we're hearing about a lot of athletes now doing it because it definitely helps to heal. And unfortunately, they have to go abroad, which is sad. It's not like we want only people to go to Panama. No, we want this to be an accepted or part of a therapeutic option, that the patient has the ability to say to a physician, I want to consider this option. And that's really what it's all about. So again, as you see there, we really go to a lot of emphasis in the quality control. We do a very, very exhaustive evaluation of every patient and every sample that's done. All the cells are really gone through a very exhaustive process. So the quality, and for us, that's a key component of what we do. So we really review every case that we get applications. There are a lot of things that stem cells have not been shown to be helpful, and we are upfront with the patient. We feel this is not an option, and so we're clear. And so we really deny a lot of applicants that simply there's no clinical evidence. But at the same time, we always are looking in the literature and other studies that have been done worldwide into what has been going on in other diseases. So we're always moving forward into looking. This is definitely an evolving field, and we're all learning. We feel that this is exciting times, and we always strive to improve the options of improvement at the end of the day to the patient. So this is something that we are really pushing forward into getting the clinical evidence. We've done more than 29 publications. I don't think any group working with adult stem cells has remotely that amount. So all the cases that we do, all the conditions that we do, there's clinical scientific evidence that we look into and that we've published. So that's obviously something very important. We collaborate with a lot of programs here in the U.S. working that are doing clinical trials here. So we have very close collaboration. They're reviewing, in many cases, the data that we've collected with our patients to look into safety and efficacy. So that's really a big thing that we promote. And we're transparent. We are really open to the public who are interested in seeing our center. We're really proud of what we've been able to achieve in our lab, in our clinic, and we allow physicians and patients alike to visit our facility. And so that's something very important that we emphasize. So again, a lot of people don't know where Panama is, and understandably that makes it very difficult when somebody makes that option of getting treatment abroad. But we're really proud of what Panama has offered. It's a city that's thriving economically and in many aspects, and so we have state-of-the-art care. We have a lot of American-trained physicians there, and the quality of care is excellent. So we're really proud of what Panama offers, and people are really impressed when they get there and they realize that it's a big city with all the advances of a modern city. Obviously, the Panama Canal is something we always have to mention when we talk about Panama, and we're really proud of what we have there. So Stem Cell Institute is a clinic where patients come in. It's not the whole building, but we have a floor there where patients come in, and that's where the medical evaluation is done, and the blood work and all the workup is done initially, and a lot of the treatments that we offer that involve the application of the IVs or the injections into the joints or intrathecals, in the cases that we do injections in the back, are all done there. We work with different hospitals where the surgical procedures are done, like the liposuctions and the bone marrow extraction, which are the other sources where we do the treatments. And this is a laboratory that we're really proud of. It's in a techno park in Panama called City of Knowledge, which is a really incredible facility that brings not only medical companies, but other technological companies that have really futuristic and very promising options, and City of Knowledge brings them in to collaborate. So we were really fortunate to get accepted there. We had to go through a very exhaustive process of evaluation for them to accept us in this City of Knowledge park. So we have the lab there that we're really proud of, and we have excellent personnel, because obviously that's the key of processing the cells. It's not a matter of getting cells out and putting them back in. They have to go to a very rigorous process of identifying the cells that are best for each condition, and they go to an extensive quality control, as we mentioned. So this is a relationship. Medistem is the lab at the City of Knowledge, and they provide the services to the medical clinic, which is Stem Cell Institute, which is in the city itself. These are the clean rooms where all the manipulation and all the processing of the cells go. So again, we're really, emphasize that we're proud of what we have there. It's really a state-of-the-art facility that, as you know, Dr. Riordan, I think, has gone worldwide to see many stem cell facilities, even some here in the U.S., and he's amazed of how, we're really way ahead of what a lot of people are doing. So we're really proud of that. This is another slide of one of the clean rooms and the personnel working. This is really where we characterize the cells. So it's very important to know what exactly we're giving each patient. There's different type of cells that have different abilities, so we're able to characterize them and know exactly the amount and the type and obviously the quality. And those are things that we can assure to improve the likelihood of clinical response. This is just a slide of the lab technician looking at the cells themselves. And we save some of the cells that we use in liquid nitrogen, so they're definitely there for further use in patients that after we do the liposuction, we'll talk about later. So specifically, what cells are found in the fat, or why is the fat helpful for these conditions? Well, there's a lot of studies done in animals for many years now that found the quality and the ability of the fat stem cells that are lying there dormant. And there's all these type of cells, the mesenchymal stem cells, which are truly the ones that have to do with the repair process, and they also have the ability to secrete, and I think Dr. Riordan will emphasize on that point as something that we're realizing a lot, that adult stem cells work not necessarily by the cells themselves, but is what they're secreting. They produce these factors that have to do with the repair process. And we're really excited what we've been advancing on this technology to identify these factors that have to do with the whole repair process in our body. And so these type of cells are there. We also have these T regulatory cells, which are to help quiet down the immune system in the conditions that your body is attacking yourself. And we have macrophages, which other type of cells, and the endothelial precursor cells are the ones that can help with blood supply. So there's several groups of cells found in that little part of the fat. It's called the stromal vascular fraction, where the stem cells are lying. And simply they are kind of in a hibernating state. And when we remove it by a liposuction, we separate all the fat and we extract that small portion that's very active in these cells that we have been finding now for many years that are very effective in many of these conditions that we treat. So going specifically into a protocol that we do with arthritis, the patients typically stay 2 weeks. They come in on a Monday and we do an extensive medical evaluation that a lot of it has been done before by phone when the patients apply, but we again do a preoperatively evaluation. We do EKGs when they're needed, and we obtain all the data. We do all the blood that needs to be drawn, because all the cells that are administered to the patients are suspended in the patient's own serum. So the patient's own blood is a carrier for the cells. And then we call it mini liposuction, even though some people that have gone through it, they say, well, it's not that mini, but we still say it's a mini liposuction. Unfortunately, there's no non-traumatic way of obtaining the fat, even though, again, this is an outpatient procedure and in general very well tolerated, but patients a little bruised, but overall they do very well, and that's the only way to obtain it. So once we obtain that, we wait a week because we have to work with the cells to separate the fat. We make sure they're free of infectious diseases, and at the same time, we just created an acute inflammation by doing the liposuction. So guess what happens if we put the cells right away? They're going to go to the area where you just created inflammation. So we have to wait typically a week, 10 days for the cells to be administered through the IV route or intravenous. Obviously, in patients with arthritis, they have joints involved. So we go to the specific joints they have mostly involved, like knees, hips, elbows, shoulders, etc. And obviously, working locally, you get significant benefits. But the interesting thing, and that's why we know that these cells repair not only the acute problem you have, but the patients, and we'll go through the case reports, report other benefits that they get from the treatment, from general well-being to skin changes to mental alertness to just many other areas where the cells are going. They're basically intelligent cells. They go to areas where there's damage. So if you have arthritis, obviously a lot of them are going to go to different other joints, not only to the ones you injected directly, but you get these other secondary benefits, which is obviously really great. This is just so you can see the plastic surgeon here doing the liposuction. I know this is not a pleasant thing to look at, but that's the liposuction extract that we get, and then this is taken to the lab and cleaned, digested, and then rinsed out, and that's where the cells are. Just briefly, we have many cases. I'm just going to briefly talk about case report, which actually the patient is right here, so he'll talk to you later. He's a 76-year-old gentleman who had arthritis bad in the knees and hands, and he barely could move because of the pain and difficulty in sitting and getting up. And he was almost bone and bone, still have a little cartilage. So we treated him again with his own fat stem cells, and we obtained almost a pound of fat. We processed it in the lab, as we mentioned. Then we injected him directly into the knees where were involved, and the other ones were intravenous. Well, he responded amazingly quick. In a matter, even while he was getting the treatments, his knee pain almost disappeared. He was having really minimal symptoms. Other benefits, as we talked, is erectile dysfunction symptoms improved dramatically. He says no more need for blue pills anymore. Bladder function improved, his hair, and those are the things that we're talking about. What they're doing is repairing other parts of your body. He had significant improvement in the movement and the swelling of the hand. And even though we did not, again, inject it directly into the hand joint, but again, those are where the intravenous application of the cells will go and deliver, again, these factors that we start talking about. The trophic factors are released, and they will travel to all these areas of where there's damage done. So his skin, which is the other amazing thing, continues to clear up. The folds in the skin in the lower neck have disappeared, and again, more alert, more involved. So overall, he had a great improvement from the treatment, and that's what we're seeing with arthritis, that almost, that's why we say that 100% of the patients that we've been treating with arthritis improve, some more than others, and there's factors that play a role, the quality of the cells. Some people have better looking stem cells than others, and age does not play a role, and that's what we have found, because these cells are, again, dormant there, and so age we have found that not to be a limiting factor of obtaining the fat cells. That's different than, for example, the bone marrow, because bone marrow definitely declines significantly with age. So the ability to obtain good quality bone marrow stem cells in an 80-year-old is very difficult. But what we have found, and we've treated, we have now in Panama an 89-year-old gentleman who had treatment for arthritis, and we took his own fat, and he's doing remarkably well. So that's when we really can tell that age is not a factor in the quality of the stem cells. The other autoimmune conditions is really conditions where your body is attacking your own body, different organs. And specifically, rheumatoid arthritis is one that is very devastating disease that attacks your joints and many other tissues. And we have found that those stem cells work really effectively, and it's a very debilitating condition. Patients who've had it, it's frustrating because all the therapies that are available really can help a little, but most of the time you get more side effects from it than the benefits. So here is the same basic process. We do the medical evaluation, they get the liposuction, and when there are specific joints involved, we go directly to the joints involved, and we typically do 3 intravenous injections. And they typically stay 10 days, 2 weeks. And the results have been really remarkable in the amount of patients that we've done. And so we were excited. In autoimmune, there are many other conditions. Actually, multiple sclerosis is an autoimmune disease that it's a more aggressive condition and involves nerve endings specifically, but we've had really good success stories with MS also. But we're focusing today on rheumatoid arthritis. So this is a case report of a gentleman that lives in Panama. He's a 61-year-old male who was diagnosed with rheumatoid arthritis in 2006. He had multiple joint pain and swelling, and typically the patient with rheumatoid arthritis have a lot of what we call morning stiffness. It takes them an hour or more to really be able to start moving. So he was having more than an hour of stiffness. He had seen a lot of rheumatologists and he'd been gone through all the gamma of medication that typically is used for rheumatoid arthritis, and very little benefits and a lot of side effects. He was frustrated, and because of the side effects he were having, a lot of these drugs, you have to be monitoring their liver functions and all these type of things. So he was really down and out. His quality of life was zero, very depressed. So he found us through my brother who knew him, and he came in, we talked, we explained to him exactly what we're talking about now. So he was really excited. I said, I got to try this. My quality of life is zero. So we treated him in August of 2010 with the protocol of the fat cells. 4 months later, the morning stiffness was 5 to 10 minutes, which is really minimal. He had significant less pain. He was walking a mile now with no discomfort. Energy level, and that's really the thing that we see invariably in most of the patients that we treat. They feel this burst of energy, and that's really what it's across the board what we see a lot. And he literally mentioned that if he got his life back, which is really, dramatic. I'm going to give you a really excerpt of him talking to us after the treatment. So,
in 2005, I was diagnosed with rheumatoid arthritis and started treatment right away. The traditional treatments did not seem to work. I changed from several treatments, and the one that did was an experimental drug, ocrelizumab. That was about 2 years ago.
Okay.
And then they discontinued it, and it really didn't work, and I started on Humira, and that really didn't seem to do much of anything. At that time, I could barely walk across the street, and I was in constant pain. In the beginning, I couldn't sleep for more than 10 minutes at a time, and I had to sit in a chair to be able to sleep for those 10 or 15 minutes. And it was very discouraging. In fact, I wanted to die. It was so intense that I didn't want to go on that way. It was not life. And even with the traditional treatments, it seemed to help somewhat, but was no relief. A year ago in August, we did the stem cells. And after about 3 or 4 months, I started to notice the difference. I can't say that I'm 100%, but for what it was to what I am, I got my life back. I can walk. I can walk. I'm basically pain-free. I still have a little bit of not necessarily pain, but discomfort in my toes occasionally, and sometimes in various joints it bounces around a little bit, but it's nothing like it was before. I did a mini liposuction, processed it, and gave it to me intravenously. People that have not seen me in a while and said that, that my face has changed and my look, I feel different. Of course, when you're living with pain, you're awful tight. And that's changed. And I just saw some people that I haven't seen in a while last week, and they remembered that when they saw me last, I couldn't walk. And they said, wow, you're a new person now. And I am.
Well, pretty impressive, and that's really what makes us continue in this, despite all the obstacles that have been placed on adult stem cells. When we get the feedback from patients that we treat, and that's what it's all about. That's what makes us go through and endure, and being a pioneer is something that's so exciting. And when you see a report like that, we have a really nice lady here who I know she doesn't want to talk, but that's another amazing case with rheumatoid arthritis. And again, it's just so rewarding when we see this. I think this was the same. So people ask me, well, is this procedure safe? And obviously that's the first thing that we look into. It's a natural process, and we have a lot of experience now. We've treated probably more than that now, and more than 300 infusions with the fraction from the fat, more than 800 total infusions. And this is more or less the amount of cells that we do, average 30 million cells per treatment, and we have really encountered minimal side effects. As you can see there, pain at the site of infusion, coldness in the arm, which both of them were very transitory. We had a case where there was thrombosis or there was clotting in the vein, because in that case we used a significant amount of cells, and because of that we reduced the amount of cells that we can do in each individual infusion. But obviously it resolved and no really sequela happened to the patient. Flu-like illness, some people feel a little feverish, but again, very temporary. And so again, as you can see, this is very minimal side effects, nothing permanent. And as I tell patients, there's really no way you can guarantee total success in the things that we treat. And there's some conditions that are more harder than others. But what we can pretty much say, nothing in medicine 100%, but when you collect all this information, that it's a safe thing. The worst thing that can happen is you don't get the benefits and that we would have wanted the patient to receive. And we've been actively, as we talked, looking into getting all the clinical evidence that we're collecting, and the University of Indiana has evaluated retrospectively all these patients that we treated with the fat, and they review all the data, and we are hopefully in the very near future able to publish that evidence of the safety of the fat. But we know, again, the safety comes from a lot of animal studies that have been done. As I mentioned, there's a company called VetStem who's been doing fat stem cell treatments to animals for many years now, and it's amazing, but it's FDA approved for animals, but not for humans. So you can treat your dog, your cat, the horse, and some dramatic improvements they received. But again, in humans, they consider it a new drug, in which that's the amazing thing. That's really the controversy with all this, that once you remove the fat or remove the bone marrow and take it to a lab, they consider that if you apply it later on like a new drug. And it's, again, your own cells, your own tissue, just working in a natural way to help you out, but that's the regulations. And sports injury is something that we've been really interested in. As you've probably seen also, there's a lot of athletes now that are going abroad to getting stem cell therapy. Peyton Manning and Terrell Owens and Bartolo Colon, the pitcher of the New York Yankees. And again, it makes sense. These injuries there's a lot of inflammation happening in the common denominator of all these diseases and all these other things with sports injury. There's inflammation involved, and these cells, we know, go to the area where there's damage, goes to the area where there's inflammation. So the repair process can be accelerated in these athletes. So definitely an injury that may take several months to heal it can definitely be accelerated by the application of their own stem cells. So this is, just to name quite a few of them. I'm going to give you a quick report on a lady that we recently treated from Corpus Christi. She's a 56-year-old female professional dancer, and she competes worldwide in tournaments, but because of the constant trauma, she developed a left knee injury in 2010 with swelling, inability to dance for a year, and she also had chronic neck pain that eventually, from a car wreck, that eventually required surgery. So she was having a lot of issues. She wanted to compete again, and basically was unable because of all this. So she was treated in 2011, just recently, with her own fat. She got 3 IV injections. We also infiltrated the left knee directly, and also she got, and I'll have Dr. Riordan talk about what we call the mesenchymal trophic factors. These are, again, what the stem cells are secreting in her muscle. And these are the results. 2 months later, I'm quoting everything that she wrote us recently, an email. I feel terrific, not sluggish or tired like I used to be. And again, reemphasizing the point of all these other benefits the patients receive. She's energetic, and her joints in general show no pain. I see changes in her skin, brighter and newer, and now she's back to dancing. With her partner, also increased ankle and foot strength. The doctor who's been following her obviously is very surprised, and he was obviously skeptical before she came, and now he's becoming a believer. So I don't know what they're doing there in Panama, but it seems like it's working. So again, the typical answer, what we get a lot of people, is the quality of life, has improved dramatically. She's not hurting now. Her neck is not hurting, and those are the impressive things that we see. This is just to mention the protocol of what we do. Patients apply to our website, and doctors are the ones who talk to patients. We get more information, and we discuss it among a medical committee to review each case individually and see if there's clinical evidence, if the patient is candidate because of what they have, because it may be a condition we treat, but the patient is not medically apt to have the surgical procedure or that. So we are really upfront, as we mentioned, of what truly can be the best case scenario for the patient to improve. And once all that process is done, then it goes through the administration exactly to book the patient. So in summary, I just want to say that, again, one really going point is that it's a natural process, and that's really what, I can't overemphasize that point. It's really allowing your body, which has that capacity to heal our body, we just activate it, but it's really dormant, and that's really, there's a slide that will be presented later of, if you look at aging in general, is we lose the ability to repair our body. And if you have a disease, then it's like a bank account. You draw it all out, and then your body can't repair itself. So really what we're doing here is activating that process to accelerate, to help it again. And so that's truly the takeaway point from all this. And then they are very effective in these conditions. Again, we're not talking in other conditions that we're treating that we're really excited about, but we can talk later: spinal cord injuries, MS, autism, cerebral palsy. But in fat derived, we're really excited of what this is offering. And thank you very much for hearing my talk. And Dr. Riordan will talk next and talk a little about the mechanisms of how all this works. Thanks.